As the battle to halt the spread of COVID-19 in Nigeria intensifies, the federal government says it would consider a proposal to approve the treatment of patients at home. This situation has become expedient owing to the rapid shrinking of bed spaces, particularly in Lagos, which has been the epicenter of the pandemic in Nigeria. According to the Director General of the Nigeria Center for Disease Control, NCDC, Dr. Chikwe Ihekuazu, healthcare providers are now being trained to go on quietly into communities without attracting attention for this purpose. For a wider discussion around this, we're now being joined by Dr. Blossom Maduafokwa, a public health physician and representative of the Association of Public Health Physicians Lagos chapter. Dr. Maduafokwa is a doctor at Lagos University teaching hospitals community health and primary care department. A fitness enthusiast, she's the creative director of Blossom's Fitness Hub, a platform that presents fitness in a fun, accessible format with the objective of guiding its clients to sustainable weight management. Welcome to the program, Doctor. Good morning.
Good morning. Thank you so much for having me.
Good morning, Doctor.
Yes.
Well, we're focusing on the proposed home care option that the Presidential Task Force has been talking about since May. Now, at the time this was first proposed, some states of the Federation said they were not going to be part of it. But we had Lagos State in particular saying that it was an option that it would consider. But now opinion is divided. The NMA president, Dr. Innocent Uja, just said that caring for COVID-19 positive persons at home will escalate the figures. What do you think? And what do you think are the main challenges with regard to home care option for treating COVID-19 patients? And do you know whether any state has started adopting that method?
Okay, so this is a very great question, and it's something that was actually well thought out before it was proposed. So the reason behind proposing the home care option was because of capacity constraints at the isolation centers. So we found out that we didn't have enough bed spaces to accommodate every single COVID-19 positive case. So the thinking is the isolation centers will be reserved for those patients that will need medical intervention to survive. So that will be individuals that are in distress, respiratory distress, individuals that have comorbidities like hypertension, diabetes, people that are immunocompromised, people living with HIV/AIDS. So these are the individuals that will benefit from medical intervention at the isolation centers. So other individuals, we know that majority of the people that have COVID-19 are either asymptomatic or have mild disease. For these individuals, so there's a protocol for them to be cared for at home. So that way they free up bed spaces for people that actually will die if they don't have medical intervention. So I believe it was last week, the Honorable Commissioner of Health in Lagos State is going ahead with the implementation of this proposal for Lagos State.
But can you take us through that protocol for treating patients at home? How does that work? Is there a standard procedure?
Okay, so there is a standard procedure. So what happens is any patient that tests positive for COVID-19 is assessed. So basically you assess to find out what symptoms the individual is having. So let's say someone has a fever and just have a cough and is not in distress. Let's say the individual is 50 years and under, you would propose that this person is managed at home. But then let's say you have another patient that is positive, has fever, has cough, has difficulty breathing, evidenced by a respiratory rate of 30 and above, has oxygen saturation that is less than 93%. Let's say the person is hypertensive, the person is diabetic. Obviously, you would want to manage this individual in an isolation center. So these are the protocols for determining who does the home care and who goes to an isolation center. So for those that do go to home care, there's a protocol for caring for them. So they have to have an actual conducive environment for being cared for at home. Let's say it's an individual that lives in a room with 20 people. Obviously, that will not be feasible. But if the home is feasible for home care, so the person can be isolated properly in a room by themselves, the person is able to wear their mask, the person is able to, the caregivers in the home will be trained actually to care for this individual. So to care for this individual, the caregivers in the home will have to wear their masks, their gloves, and sometimes they will need to wear a gown depending on what they're doing for the individual. So there is a protocol and there is actually training that is involved before home care can be instituted. Another thing is the healthcare providers checking with these patients daily to ensure that all the protocols are being adhered to. And if the patient begins to decompensate, then the person will be moved immediately to an isolation center. I do have people I'm actually monitoring by telemedicine. They have mild symptoms. They don't need to take up bed space in an isolation center. So I chat with them every day. I call them. We talk about their symptoms. And if they're doing fine, they continue to be managed at home. So that's the way it works.
I want to talk about something very important, which is the stigma of people that might be taken care of at home and people that currently might have recovered, because it's very, very important.
Correct.
Societal stigma, you're still seen as though it's a societal plague for you to have COVID. Exactly. What would you say as regards that? And take, for instance, if you stay in a flat, a block of flat with other people, and you've been home cared and you've been treated for COVID in your house, most people might not want to come around you. They might not even want to live in that flat again. They might want to move off the flats.
Yeah. So absolutely, this is something that we're battling with, and it's platforms like yours that we need to use to put the message out there that COVID-19 is not. It's an illness that when you recover from it, you are not going to affect anybody if you are no longer testing positive. Even I, as a healthcare professional, sometimes people sort of try to distance themselves because they don't know who I've cared for. So it's platforms like yours that we need to use and put the message out there that, look, you can have COVID-19, lots of people have it, no symptoms, mild disease, and they recover and they're fine. So it's not a death sentence, it's not something it's not a chronic disease. So you're not going to infect people with COVID-19 for the rest of your life. So information is key, and we need to actually push this message out there.
Well, I'd like to ask you a question about cost. What we know is that in the United States, the cost of treatment per unit, that's per patient for COVID-19, could range from about $5,000 to about $80,000, depending on the duration of stay in the hospital and the severity of the case. Here in Nigeria, do we have an idea? Is it possible for you to tell us how much it costs to treat a patient, a COVID-19 patient?
Okay, so I can't give you the figures because, as we know, COVID-19 is a novel disease, so it's not something that we've encountered before. And we know that there's a whole wide range of manifestations of this illness. So someone, for example, like the patient I was managing yesterday, this patient just has chills, and that's it. And all he has taken for this illness is paracetamol. So the cost of treating his own COVID-19, managing his own COVID-19 is probably no more than 500 naira or 1,000 naira. Another individual might require critical care management. So you understand what I'm saying? It's a very, very wide range that you can't put actually a figure on a party and say this is how much it costs to treat a COVID-19 patient.
And it's precisely that wide range in the way symptoms present themselves that's causing some apprehension about some of the other new guidelines that we were told, that there will be no negative tests as a requirement for discharge. Patients who are symptomatic will be discharged at least 10 days after symptoms onset and 3 days without symptoms. Asymptomatic patients will be allowed to go home 14 days after their first positive test. This is making people slightly worried. I'm sure you can understand why. Can you address that, please?
I completely understand. I completely understand why people will be uncomfortable with that. And let me explain the thinking behind some of these policies that we're getting. So some of the thinking is we're trying to free up bed space in the isolation centers. So we've had people that have been in isolation centers. They have no symptoms, but every time you test them, they test positive. So they keep occupying that bed space. So this is one of the reasons, this is one of the policies that they had to put in place to free up bed space, to say if you're not having symptoms after a certain number of days, you have to free up that bed space. So the public, everybody is concerned. So that means we have people that are positive that are walking around. And this is why accompanying these policies is personal responsibility. Wear your mask. We always have to preach this. Once you're leaving your house, you have to have your mask with you. Because that way if let's say you're asymptomatic and you don't even know it, and you have COVID-19, at least you protect other people. And then when you do wear your mask, you actually give yourself some level of protection. You wash your hands, try not to touch your face. So these protocols that we put in place when we had the lockdown, people need to remember that we need to keep doing the same things. Because now that we're freeing up bed space by discharging people that maybe are still not testing negative. So we need to have some extra level of protection on a personal level. So that is one thing that we need to keep telling the public. People really need to be aware that this is what you need to do to protect yourself.
All right, I just want to know who bears this extra cost? Because definitely you have ancillary extra costs to have health care professionals visit homes and offer care. Who bear this extra cost? Okay, and who bear this extra risk layer?
Okay, so the healthcare professionals are paid by the state government. But what we do with the home care, there's a lot of telemedicine involved because you also need to remember we're observing social distancing. So like I talked about the patient that I'm managing. I have actually never met this person. So it's all telemedicine. So while we reserve like the visits for, say, a patient is decompensating and needs critical care immediately or needs to be moved to an isolation center. So that is where we actually apply the home visits. Or let's say we need to visit the home ahead of time to ensure that the environment is feasible for home care. So that's where the home visits coming.
Well, sometime in April, the Lagos State Commissioner for Health informed the public that the Lagos State government was going to embark as part of its strategy for containing COVID-19 on community active search, or what the government called house-to-house search for persons who may have symptoms of COVID-19. Do you have any information on how far they've gone with this, or whether not seeing that it's a very feasible option, have decided to abandon it?
Okay, so this is actually being done. Honestly, it's actually being done. I have colleagues that actually do the door-to-door search, as it were. And you have health centers that people come and get tested. So that is being done. And that's some of the source of some of the rise in the number of cases that we saw were from some of those community searches. So that is being done.
So for your patients who require more advanced medical intervention than paracetamol, what is the current drug therapy? Because it's all rather confusing. On one hand, we've been told antivirals, antiretrovirals work, antimalarials, zinc. What exactly is it that as more is being discovered about the virus, previous treatments have been jettisoned, or are they being added onto? Okay,
so there's no treatment for COVID-19. So right now, there are different drugs, medicines that are being tested for COVID-19. So there are different protocols. What we currently are involved in are trials. Like even in the US, in Europe, there are drug trials going on constantly. I think it was a few weeks ago in the US, they found out that the drug remdesivir had a positive effect in shortening the stay of patients with COVID-19 in the hospital. So it's like we said, it's a new disease. So we're really like watching as we go. So there's no treatment for COVID-19. What we do offer is supportive care. When the patient has symptoms, we treat the symptoms, we manage the symptoms, and that is really what we do at this point. There's no known treatment, yeah.
Real quickly, I want to know about the healthcare professionals that might have been, infected with COVID-19. The number keeps increasing.
Yes.
What care do we have for them, and what are we telling them to do as they go out to the front lines?
Okay, so the healthcare professionals that tested positive, obviously I'm a doctor, so I know a number of them. They're being treated in isolation centers. Some of them are being treated at home. It's basically the same treatment that we give to our patients that we give to our colleagues that test positive. What we have done is to push for trainings in infection prevention and control, because that is so key in protecting healthcare professionals when they treat patients. You need to understand how to don your PPE, how to doff your PPE in such a way that you protect yourself and you also protect your family members that live with you. So to answer your question, the healthcare professionals, they get treated in isolation centers or at home just like other patients.
Well, quickly, I don't think we still have more time, but I see that you are the creative director of an outfit called Blossom's Fitness Hub.
Yes.
Is there a connection between fitness and surviving COVID-19?
There is 100% a connection between fitness and COVID-19, because when you're fit, let me use that word, when you're fit, you have the immune system to be able to fight or survive COVID-19. Your level of nutrition is such that you're incorporating your vitamins, you're incorporating your minerals, and these are so vital in helping you fight this disease. So fitness is so key. And another thing that fitness helps you to do, especially in this time, everybody's locked down, there's a lot of depression going on. When you have a regular workout regime, it actually raises your endorphins, it raises adrenaline, your mood is a lot better, and for me personally, it helps me even better take care of my patients. So there's a very huge connection, yes.
Thank you very much, Dr. Blossom Maduafokwa.
You're most welcome.
Thank you very much indeed.
Thank you.